in the heart of Kuala Lumpur lies Lembah Pantai, home to over 15,000 residents in the program Perumahan Rakyat, or PPR. But this community faces a silent and dangerous threat, dengue fever.
The changing climate, which increasingly favors mosquito breeding, and also the proximity of these PPRs to the Klang River, compound this public health challenge, highlighting the importance of adaptive measures like the B.O.L.E.H project.
Climate change, crowded living conditions, and the nearby river create the perfect environment for mosquitoes to thrive, increasing the risk of outbreaks.
The project name B.O.L.E.H stands for B40 Communities Organizing Local Solutions for Environmental Health. B40 refers to the bottom 40% income group here in Malaysia. And the B.O.L.E.H is very familiar to Malaysia because it's a Malaysian term, which means can, we can. So Malaysia B.O.L.E.H, Malaysia can, we can do it. When we work together in unity, we can protect our families and prevent dengue in our community.
Across Malaysia, dengue cases are climbing, putting pressure on public health systems and affecting families in deeply personal ways. With a generous grant of close to RM350,000 from Prudence Foundation, the project launched targeted interventions in Lembah Pantai.
The B.O.L.E.H project stood out because it goes beyond awareness. It is all about empowerment. This is a community-led approach where it's supported with data and also with measurable outcomes. At Prudential, our commitment is to build resilient communities, and this project's ability to mobilize residents, volunteers, stakeholders around a shared goal makes it a truly compelling initiative for us to support.
Mosquito larvae traps were installed on every floor, cutting mosquito populations before they could spread disease. Mosquito netting was placed on lower floors, adding a vital layer of protection.
Di Pantai Ria ini adalah kawasan merah, kawasan yang paling tinggi sekali masalah Aedes yang ada di sekitar kawasan Pantai Ria ini.
To raise awareness about dengue, residents took part in a community competition where the cleanest floor and the most creatively designed communal spaces at the lift lobbies would win prizes.
Saya sendiri membuat pemantauan, penduduk-penduduk semua mengadakan gotong royong.
These activities target mosquito breeding sites while strengthening community spirit.
Kalau ada saja diorang nampak ada tempat air yang bertakung atau sampah sarap, mereka akan beritahu pada penduduk lain supaya bersihkan. Tak macam sebelum ni lah, tak macam sebelum ni. Even rumah jiran yang nampak ada nyamuk terbang pun dia buat aduan lah kepada kita. Memang bagus. Kes tahun ni kita hanya satu kes dengue sahaja di tempat saya. So compare tahun lepas 20 lebih kes. Jadi memang begitu mendadak lah.
So the interventions are aligned with WHO's control of neglected tropical diseases, which are vector control, to assess the effectiveness of environmental health solutions such as having air curtains installed at lift areas and having AI-assisted fogging to increase the household protection.
To support residents' knowledge in order to take charge of their own environment, fun educational activities such as pop quizzes were also conducted.
I realized that public health is more than just giving out information, but is more about listening and involving people. I now understand the importance of working with the community to prevent illness and not just treat it.
The result? A cleaner, safer neighborhood where families can live without fear of dengue.
We had been focusing on Lembah Pantai for the project, but we hope that the residents in the PPR Lembah Pantai have been empowered to replicate the knowledge and the practices and go on to be ambassadors to spread the awareness and train residents from the other PPRs in other areas in KL and beyond.
The B.O.L.E.H project shows that when communities unite, they can overcome even the toughest challenges, protecting their health, their families, and their future.